From Discovery Health Channel and ABC News.
Hello and welcome to She TV. On Body Watch, you know how good you feel when you drop that extra 5 or 10 pounds. So imagine the thrill an obese person feels when they lose hundreds of pounds. But the thrill only goes so far because they often face the question of what to do with the excess skin left over after the weight loss. The answer to that question is a surgical procedure called a body lift. But there's a side effect to dropping all that weight that many people don't realize: excess skin.
Okay, Marjorie, at the hips, she is 35 3/4 inches. I want you to push out on your abdomen. Push.
When these patients come in and they've had this massive weight on, their skin has been stretched out to a point that it needs to be. Then when they go ahead and lose the weight, the fat is reduced through the various surgeries, but the skin will only shrink to a certain point. That's where we come in. She's lucky. She has more skin retraction than most patients, and that's because she's 19 years old. Quite often, after losing the 150 pounds or so, which she has, there would be twice as much skin. I think psychologically, people, look down at their abdomens and they see all this extra weight and this pannus, and they just want to get rid of it. After that, I think women often go to the upper arms and the inner thighs. Men oftentimes go to the neck, possibly buttocks, and then there's always some variability on either ends of the curve. It's amazing to me when we do this surgery and we lift up the skin and the fat and we roll back these flaps before we actually remove them. Sometimes you look inside and you see the core of the person, the musculature and where all the organs are and everything. And it's a person that's, my size or your size or anybody else's size. And they're just trapped in this tomb of skin and fat.